everyone, and welcome back to the Home Care You Say Updates podcast. Today, we're talking about a term that comes up constantly in conversations, whether in advocacy, talking about Medicaid, home care, aging, disability services, and much more. That is LTSS, or Long-Term Services and Supports. And rather than throwing a bunch of definitions and acronyms at you all today, I want to explain this using a really simple picture. I want you to imagine two umbrellas. The first is the LTSS umbrella, and this is a big umbrella. Under that big umbrella are many different ways people can receive long-term services and supports. Then, underneath LTSS, there's another umbrella, HCBS, or Home and Community-Based Services. And underneath the HCBS umbrella are many of the actual services that help people live safely and independently in their homes and in their communities. So if you can picture those two umbrellas, you can understand a huge portion of the long-term care system. So let's start with the biggest one, LTSS. This stands for Long-Term Services and Supports, which is a broader term we use for ongoing help people may need because of aging, disability, chronic illness, or another condition that affects their ability to live. The word ongoing is very important. I want you guys to underline that. Traditional health care often involves treating a specific problem. You get sick, you go see a doctor, you receive treatment, hopefully you recover. Long-term services and supports can look very different than that. Some may be medically stable, but still need help every single day. They might need help with getting out of bed, bathing, dressing, eating, using the bathroom, moving around safely, with meals, medications. There's so much more that goes into this list. And sometimes these needs last months or even years, or throughout a person's lifetime. That is why we call it long-term services and supports. And I really like the word supports. I want to underline that word too, because not everything under this umbrella looks like traditional medical care. Sometimes the support is helping someone learn a skill. Sometimes it's modifying their home. Sometimes it's giving a family caregiver respite. And sometimes it's helping someone work or participate in their community. So when you hear LTSS, don't picture one singular program. Picture the big umbrella that all of those programs and services and supports live under. So who is under the LTSS umbrella? Who receives these services? Another thing I want to make clear is LTSS is not just for older adults, as some may assume. Older adults are an absolutely important part of this system, but children and working age adults are an LTSS too. That could be a medically complex child who needs nursing care, an adult with an intellectual or developmental disability, a person with a physical disability who needs personal assistance. It could be an older adult that needs assistance with bathing, dressing, all those things we listed before. In fact, more than half of Medicaid enrollees who use LTSS are under the age of 65. That surprises a lot of people. So when someone hears the term long-term care and immediately thinks elder care, that picture is too small. LTSS serves people across all lifespans. So let's talk a little bit more about what's under this umbrella. LTSS, there are two major ways people can receive care: institutional services and home and community-based services, that other umbrella I was talking about. So let's briefly talk about institutional care first. Institutional LTSS includes settings such as nursing facilities and certain other residential facilities where people can receive ongoing care. And I want you to remember, institutional care is an important part of the system. We talk about home care a lot, but sometimes institutional care fits others better. That is their top choice for care, and we want to ensure that that is available to them just as much as home care is available to those that would like to stay and receive care in their home. This is not about saying institutional care is bad. The bigger point is institutional care is one option under the LTSS umbrella. Historically, people often associate long-term care almost entirely with nursing homes. In the past, and even now, that still happens today in conversations. But as we all know, today, we have a much broader picture of LTSS. This brings us to our second umbrella, and that's HCBS, or Home and Community-Based Services. This includes where people are able to receive care in their homes and communities rather than in an institution. And this is where many of these services we talk about on this podcast live. Under the HCBS umbrella, depending on the state and the program, I want to make sure I'm sound like broken record Bliss with this comment, but every time we're talking about this, I'm trying to talk in a broad aspect. HCBS can look differently in every single state. So please, if you want more details specifically about your state and what falls under this umbrella, please reach out to us. So let's dive back into it. Things that typically fall under most states' HCBS services umbrella is personal care, private duty nursing, or PDN for short, habilitations, respite, supported employment, home modification, case management, transportation support, community participation services, and other things as well. Now, the system starts to make more sense. LTSS is the bigger umbrella. Under that, you have institutional care and HCBS. And then under that HCBS umbrella, you have many of these very fine-tuned specific services that people receive in their homes and communities that really tailor to what they need. Let's dive right into the next portion. What do those services actually look like in real life? And let's make this real. So let's start with personal care. Personal care may help someone with bathing, dressing, eating, toileting, mobility, and other everyday activities. These are things many of us do without even thinking about them. But for someone who needs assistance, having that support may be what allows them to stay safely at their home. Now, private duty nursing, or PDN for short, is another example that it provides longer duration skilled nursing support for someone with significant medical needs. That could be a child with a complex medical condition who needs nursing care throughout the day. That nurse may be a major reason that that child is able to remain safely at home with their family. Habilitations can help someone develop or maintain skills needed for everyday life. This is particularly important for many people with intellectual or developmental disabilities. It might involve learning how to complete daily activities, communicate, participate in your community, or become more independent. Now let's talk about respite. I'm excited to talk about this one because this is such a backbone to our home care group. So respite gives family caregivers temporary relief. That might allow a parent or a spouse to go to work, to attend an appointment, to sleep. Sleep is a big one. To run errands, care for another child, or simply have a short break. And that support can be incredibly important in helping families continue caring for someone at home. So I want to kind of paint a picture with some data points about why HCBS matters so much. So according to CMS, most recent detailed Medicaid data as of 2023, 8.4 million people used Medicaid home and community-based services, compared with about 1.5 million people who used institutional LTSS services. So that's a lot of people, guys. I want us to think about that for a second, and especially looking at how broad HCBS has become over many, many years. It is just incredible to see that many people who find being at home better for their care are able to access that resource. And same for those that are able to access institutional care options. So those groups can overlap somewhat, but the difference still shows just how important HCBS has become. And as you can tell, I still get tripped up with the acronyms too. So don't let all this information overwhelm you as we continue talking about this, because believe me, it's more important to know what the acronyms mean and what they entail than be able to constantly repeat them as I'm trying to do today. Let's talk about where Medicaid fits in. We've talked a lot over the last couple podcasts about what is Medicaid, what is our waivers. So I want to talk about how all of this kind of fits into this topic. So because LTSS does not automatically mean Medicaid, there are other ways people receive or pay for long-term services and supports. Some people pay privately, some have long-term care insurance, there are veterans programs, there are aging programs. Families also provide an enormous amount of unpaid care. We're talking about those family caregivers. And Medicare may cover certain, very certain skilled services under specific circumstances. But Medicare generally does not pay for ongoing custodial long-term care simply because someone needs help with everyday activities. That is where Medicaid becomes especially important. Medicaid is the primary public payer for long-term services and supports in the United States. So we're talking about LTSS, we're talking about Medicaid. That's the main thing. So moving on, I want to dive a little bit more into where waivers fit in here. Since if you missed last podcast, I really recommend before we go into this to go back and listen to that so you can understand kind of where I'm coming from when I'm talking about these waivers and how they fit under these umbrellas. So let's connect it. Medicaid waivers can be confusing because people sometimes talk about them like they're a complete part of the system or they're completely separate from the system. So, kind of give and take here. Go back to our umbrellas. At the top, we have LTSS. Under LTSS, we have HCBS. And then, underneath the HCBS umbrella, states use different Medicaid tools to actively deliver those services. One of those tools, under that umbrella, is a waiver. For example, the 1915C waiver allows states to provide certain home and community-based services to eligible populations. But a waiver is not the same thing as HCBS, and it is definitely not the same thing as LTSS. A waiver is simply one way Medicaid can organize and pay for some of the services underneath the HCBS umbrella. Some HCBS services can also be available through the regular Medicaid state plan or other Medicaid authorities. Again, broken record Bliss here. This does not always fit in the same box for every single state. Remember, your state is specific. No matter where you live, all 50 states, not all of them are exactly the same. So please take everything I'm saying at the broad level and do more research about your specific state. So if you remember nothing else from this section, LTSS is the big umbrella. HCBS is the smaller umbrella underneath it. Waivers are one of the tools used to provide some of the services underneath HCBS. And that's it. You don't need to memorize everything. Section numbers, not important to memorize. It's important to understand the structure. It's important to understand kind of the top to the bottom. And let's talk about why these two umbrellas even matter. So I think this framework is helpful because we throw these terms around like everyone already knows and understands how they relate to one another. But think about it this way. If someone receives personal care services at home, that service may fall under HCBS. HCBS falls under LTSS, and Medicaid may be the program paying for that service. If someone is receiving nursing facility care, that is LTSS. But it falls on the institutional side, not underneath the HCBS umbrella. Once you understand those umbrellas, I know I've said that word a lot this time, all of these terms will stop feeling quite as random. So, now let's talk about how you move this into advocacy. How do we take this new understanding we have of these umbrellas, all of them, and we put it into action when communicating to a legislator who probably doesn't know how any of this works either? If you're meeting with a legislator, you may understand every one of these acronyms. They may not, and that's okay. Your goal isn't to prove that you know more Medicaid terminology than they do, or even someone that's outside that's not even a legislator and you're trying to teach them. Your goal is to make them understand what the policy actually means for a person. So I would not walk into a legislative office and start by saying, we need better access for HCBS within the Medicaid LTSS program. I lost you all right there. I lost myself. And that may be a technically correct sentence, but it doesn't give someone as much of a picture. You want to paint that mural for them. Instead, start with the umbrella. You might say, long-term services supports are the service people may need over time because of aging, disability, or chronic condition. Then narrow it down. Try this sentence. One part of LTSS is home and community-based services, which allows people to receive those supports in their home and communities. Then explain the actual service itself that you're there to talk about. So you could do something like this. For this family, that means a nurse coming into the home every single day to care for a child with a chronic illness. Or, for this older adult, that means someone is helping them bathe, dress, and prepare meals every day. Or you could also say, for this person with an intellectual or developmental disability, that means support learning daily living skills and participating in their community. Now the policymaker and you all can see the person behind the acronym. And this is a great time to add in a personal story. You can kind of use the sentences I just gave you to build out a story off of maybe someone you know, your own experience, or even someone that you've worked with before with their permission, of course. That is a way that you can frame a conversation to explain to a legislator exactly what you're there to talk about, so you know and they know what programs you're discussing, but they can also see the individual behind it. And that's where we go into the umbrella to the person. And that is really the advocacy lesson I want you to leave with. Start broad, then get specific, LTSS, then HCBS, then the service, then the person, then the outcome. For example, LTSS includes services that help people with disabilities live independently. Home and community-based services allow those services to happen at home. Personal care is one of those services. Mary needs help bathing, dressing, and preparing meals. That service allows Mary to continue living safely in her own home. Now you've taken something that sounded like complicated Medicaid policy and turned it into something almost anyone can understand. And once a legislator understands the person, it becomes much easier to explain why workforce access, waiver capacity, or reimbursement policy matters. So the next time you hear LTSS, think a big umbrella. Under the big umbrella are different kinds of long-term care, including institutional services and home and community-based services. Then think about the second umbrella, HCBS. Under that are many of those services we've been discussing that help people remain at home and in their communities. Personal care, private duty nursing. We're going to go into all of those really soon. I'm going to dive deeper into all of that. But the biggest thing is Medicaid is not the only part of the LTSS system, but it pays for a major role in how these services are provided. It's a big thing to remember. And for my waiver fans, waivers are simply one of the tools in the tool belt Medicaid can use to provide services underneath the HCBS umbrella. But at the end of the day, none of these terms matter unless we remember what is underneath all of them, the people. A child receiving nursing care at home, an adult with a disabled learning a disability, learning how to live more independently, an older adult getting help with everyday activities, a family caregiver getting a few hours of respite. Those are the people behind LTSS. And when you are talking to a policymaker, that's where the conversation should always come back to, no matter what. Thank you so much for joining me for another episode of Home Care USA. I'll talk to you next time when we dive deeper into all of the things we have continued to talk about through the last couple of podcasts, and I hope throughout the next few episodes, you will feel it all connect together and you will be an expert on everything when it comes to educating a lawmaker on Medicaid and home care. Thanks, guys. See you next time.